official YouTube channel. Kindly subscribe the channel and tap on the bell icon which is present below the video so that we can keep you updated. Welcome to International Longevity Center India. Thank you for using our official YouTube channel. Kindly subscribe the channel and tap on the bell icon which is present below the video so that we can keep you.
Okay, yes, so I'll start. Good evening, everyone. I'm Yashoda, and I welcome you all in this national level online webinar series organized by the International Longevity Center India with the CSR support of Gharda Chemicals Ltd. Today, I'm really happy to host Cherian sir, and he's going to speak on the topic Challenges Faced in the Field of Population Aging, Looking Back and Ahead. Welcome, sir. I will now introduce him to you and then we will begin the session. Before that, I request Umranikar sir to please welcome him.
This is basically to welcome Mr. Cherian for a session on behalf of ILCI. I'm extremely happy to have you here, sir, and I would like to hear your thoughts on the subject. The subject is very thought-provoking, and would definitely like to learn something from you. The way you expound the subject will help us to develop our programs also. So I won't take more of a time, and I will request Ashura to go ahead with the program. So welcome again, Cherian.
Yes, thank you, sir. Thank you so much, Umranikar sir. Now, as I mentioned, I'll now introduce him to you and then we will begin the session. Mr. Mathew Cherian is Honorary Director of ILCI. He is also the Board Chairperson of Care India. He is well known for his former position as CEO at HelpAge in India, which he served for more than 15 years. He is BE Honours in Civil Engineering from BITS Pilani, Rajasthan, and holds a PG diploma in rural management from the first batch of IRMA, that is Institute of Rural Management, Anand, Gujarat. Later, he worked in the area of rural development with the cooperatives in association with the National Dairy Development Board. He also served as director of Oxfam India from 1987 to 1994. He continues as the global ambassador for HelpAge International and also GuideStar India International. He is also a member of the Global Future Council of World Economic Forum. Currently, he serves as an amicus curiae, that is, friend of the court, to the Supreme Court in the elder rights matter for pensions, homes, and the maintenance law, which has helped bring elder issues to the forefront. It's an amazing profile and wide experience of working in such interdisciplinary domains. So I welcome you, sir, again, and I request you to please begin the session. Thank you.
Thank you for that long introduction, and thank you, Jain, Tanjali, etc., for inviting me to speak on this occasion. And in my 17, 18 years of experience with the field of aging and also with older people, I've come across certain crisis which is emerging in India's aging sector. And in the next few minutes, I'll be talking about that because that is something which I call as the graying of India. We all keep riding on the fact that India has a young population, but this young population is soon going to grow old, and which will be the graying of India. And as a result of it, we will not be able to see proper healthcare pensions for the elderly. And this is going to be one of the major issues which I'm going to talk about. So if you in India, what is happening is we have a great increase in longevity. There's a longevity of 20 plus years, which is going to come in the next few years. And the impact is that most of us are going to cross 90 years of age, which is good news. But at the same time, it affects retirement planning, affects social security, it affects healthcare, because we have to plan for another 30 years after you cross 60, which is going to be a big burden both on policy making, on the government, and also on personal lives. So this is the big increase in longevity, and as part of the International Longevity Center, you people are definitely aware of this increase in longevity, but we have to prepare the country for this increase in longevity. The second major trend which we are seeing is what we call as the rise of the empty nesters. So when children fly away from the nest, and then you parents leading what is known as the empty nest syndrome, and this has become a big factor in most parts of the country. The migration of children in the southern part of India and the western part of India are the highest contributors. The north and the east are still low on this factor, but it is slowly catching up in these areas as well. And at the same time, because of the rise of empty nesters, families are restructuring. We no longer have joint families, we have nuclear families, and even the nuclear families are becoming sub-nuclear families. As a result of it, we need to arrive at new models of senior care, which are emerging in some places, but the whole country is yet to see any of this. And the other factor which is happening is the older people today also want a greater quality of old age care. No longer are they willing to be looked after or left in a corner. They have become more demanding. They demand the highest standards of quality care. And since HelpAge, we have been running old age homes. We see even in the old age homes, they require a greater amount of care. And this is becoming, so the care burden is going to increase over the years. And it comes to the next fact, which is the non-communicable diseases is on the rise. So what happened during COVID, you increasingly started hearing the word comorbidities. And what happened is most of the elderly, when they cross 60, are suffering from comorbidities like hypertension, diabetes, COPD, and other kind of ailments. As a result of it, they do not, unless they treat these diseases, they have a high risk of suffering from this and resulting in ultimate death. So the increasing longevity with poor health is a kind of factor which is happening. To counter this, the government in the year 2010 started a program called the National Program for Healthcare of the Elderly, NPHC, which was launched on October 1st, 2010. And some of us were present at the launch. But what happened is it promised one health center for older people in all the districts of the country. And even today, only 241 districts have any form of geriatric care out of the 747 districts in the country. So during COVID, this was completely exposed, and we could see the number of deaths amongst the elderly was in the higher region than the other subpopulation groups. So this was something which elderly have to take care of. And we have seen variants, the Delta, the Omicron, there may be further variants, but all of them are going to affect elderly with comorbidities. So unless we make preparations for healthcare in all the 747 districts of the country, we are going to be vulnerable to all these health. And so with the empty nesters and the rise of NCDs, non-communicable diseases, there is requirement for home care. There is requirement that older people can be looked after in their homes. And so aging in place will become the next big trend. We have already seen in the major cities, home care providers and even home care is in great demand. And what is going to happen is this demand is not only going to increase, it is going to quadruple. And I estimate that there will be several requirements for home care in most of the cities. And in rural areas, it's yet to come, except in rural Kerala, which has the highest population of aging. And as a result of it, you will find this requirement increasing. And some of you who are in Pune would have also noticed the rise of home care. And aging in place is a trend which most older people don't like to go to old age homes or to retirement homes. They would like to live, and they would also like to live till the last days in their own home. So aging in place is something which has to become the trend for India, because we can have our older people living in old age homes and retirement homes, etc. That will become a major burden for the elderly and for the young populations. So if you look at it, as a survey showed that 40% of the elderly have locomotor problems in walking. And there has been a rise in the central nervous system problems, and many of them are suffering from problems with the nerves, etc. And 17% have cardiovascular problems, and 13% have gastrointestinal problems, and 6 to 7% also suffer from psychiatric problems. Psychiatric problems in old age is a much neglected problem, and many people don't even like to talk about it, but it is true that many suffer from that. And there's also a high proportion of people suffering from falls, and in a state like Kerala, about 90% of the deaths in old age are due to falls. And as a result of it, they have to have some fall prevention mechanisms and also take proactive steps. So in 2016, I was requested by the Supreme Court in a writ petition to look at the rights and what can be done. And so this petition of 2016, where it was said that the elderly suffer from lack of rights, elderly also do not have proper health care, and many of the tribals and scheduled castes are excluded from health insurance schemes. So as a result of it, how can we prevent exclusion, and how can we get elderly back into the ambit of social security in the country? So this was one of the major attempts of the PIL, which I will talk about later. So in a study done by HelpAge India on elder abuse, the other trend that they said was that elder abuse is on the increase, and most people said that their future was very bleak. About 47.4% elderly felt that their future was bleak. And they also felt that they had a fear of being affected by COVID, because this survey was done during the period of COVID. And the only solution that the government gave was to stay isolated and to stay indoors. Nobody was even providing them with the basic medicines for NCDs. And as a result of it, many of them feared that they would die. At the same time, there is also a feeling that in the house they are being abused, and the major people feel that both son and daughter-in-law are one of the main abusers of the older people, and many of them feared for getting abused both verbally and in some cases physically. So the lockdown had a negative impact on the elderly, and only abuse has grown during the lockdown. and also during the COVID phase. So our worry is that elder abuse in the country, 1 in 3 elderly always indicate that they had suffered from elder abuse in their own homes. So this is a worrying trend, and along with the problems of health, this elder abuse only accentuates their health and creates major problems for them. So now, if you look at the current population of elderly, which is about 120 million, the bulk of them can be put into a triangle where 10% only are in the socio-economic segment A, which is the top of the economic class, which is people who are rich and the upper middle class fall in this. And about 40% are in socio-economic category B and C, and 50% are below the poverty line, which is socio-economic category D and E. These classifications are Government of India classifications, and we find 50% of the elderly are so poor that they even can't afford a single meal. So this population needs support, and without a proper pension and social security, we would not be able to reach out to elderly. And if you have no money to buy medicines or to take care of yourself, then the life is going to be extremely difficult. And this is something that many of us should be applying our efforts to see that pension can be available to most people in this country. So when we did the analysis of the pension system, we find that the pension system is very poor in the states which are the ones which are on the lower curve. The ones which are giving a pension of 1800 rupees are Kerala, Delhi, Goa, Andhra Pradesh, and Arunachal Pradesh. But even after this Supreme Court judgment, both Andhra and Telangana have increased their pension. But Maharashtra is still to increase its pension, and so are many other states. And this pension amount is a big boon to the elderly when they get this pension, because the pension is shared with all the members of the family and it is not just kept for the elderly. And the government's contribution, the central government's contribution, is only 200 rupees per person per month, which I think is completely lacks dignity to the older persons. And we find that they don't even, today, the value of the 200 rupees is way below 90 rupees. So, what is 90 rupees in today's context if you give this as a pension for 1 month? So, increasingly, this presentation was made to the Ministry of Rural Development, to the at the center, and I was a member of the National Social Assistance Program, which was arguing for more pension for the elderly and more pension for the disabled, etc. And we said that the pension amount should be revised at least to 2000 rupees per month, which is definitely much better than what they give, an undignified amount of 200 rupees. And at the same time, it should be indexed for inflation, because if you don't index it for inflation, again after 10 years I would be telling that government is only giving 2000 rupees. The value of that 2000 rupees is down to 200 rupees, and as a result of it, we have to index it every year. When other people can get their DA and increases due to inflation, I think elderly also deserve to get their pension amounts due to inflation increased, and this is something which needs to be done. And if you look at the coverage of pension, if you look at the orange curve at the bottom, the states of Bihar, the states of Gujarat, Orissa, Rajasthan, and even Uttar Pradesh have very low coverage of pension. So this is something which we need to really see, that pension is also covered. It is not not just to be given to a few people and not given to the entire population. So we argue that there should be a universal coverage for pension, and the percentage of pensioners in the elderly population is, if you look at the curve for Rajasthan decided we won't give a high amount, we will give only 500 rupees, but we will give it to most of the elderly. So about 95% of the elderly get 500 rupees. So they don't get a large amount, but they get a small amount, and that is distributed to a larger population. So different states seem to have different strategies. There is no uniform strategy for social security. Though the government claims that they are going to bring about social security, it's yet to be implemented for the elderly in many states. And there's also this disbursement and using the Aadhaar card as and fingerprints as a argument for directly transfer. You might have heard of DBT, direct benefit transfer, which is done through the Aadhaar card approach. Of course, it was a measure to prevent leakage, but the bulk of the elderly, either their fingerprints don't match, either the internet doesn't work in many of the villages, and as a result of it, many have not even got pension for many months together. It is like people not being paid their salary at the end of the month. You're paid once in 6 months, or you're paid once in 9 months, depending on the thing. But the scheme for pensions had, you could choose the form of pension. If you want to get it through the post office, you could get through the post office. If you wanted doorstep delivery, you could get doorstep delivery. But at the same time, that is still not being allowed to the elderly, and elderly are forced to wait for months on end to receive their pension. This is a situation which cannot be tolerated by those of us who work for the elderly, and government needs to apply their steps to see that. And unless we can have a transparency and accountability in this area, and if you can see whether the pensions have reached the people, and they are supposed to update all the data on their portal, but unfortunately, many times I've gone to the portal, it doesn't seem to work, and it doesn't have updated data. So this is something which needs to be displayed not only at the internet level, at panchayat level, and in ward offices, because there should be a transparency down to the village level. It need not be just for people in the cities who have internet and Wi-Fi to look at it. It should be available at the panchayat and at the village level as well. So if you treated each of these states as independent countries, then the GDP, they are giving less than 2% of the GDP towards pensions, etc. So this is something which we need to increase, and we feel that at least, since elderly are now about close to 10% of the population, we deserve to have at least 10% of the GDP also devoted to us. And unlike this 1% and 2%, which is at present seeming the norm, we need to get more contribution towards the elderly. And in this, all states are liable for giving this money so that they can keep the elderly in a socially secure environment. So the summary of this whole future of aging is, we have an increasing longevity of 20 plus years. We may live to be 90 years, but you may live with decreasing health care. And unless the government puts in better healthcare facilities, we will live long but live with poor health. And then, unless pensions are restructured, we will live with no money, poor health, and long life. And then the other area is, as we grow above 80 years, the frailty level increases. There is an increasing frailty which is observed in old age, and very little effort is being done by even the leading hospitals towards this frailty. So as a result of it, there are increasing falls. There are very little prevention mechanisms which are going on. So I think both at ILC and other agencies involved in aging, we need to work out new models of aging in place. Unless we work out new models for aging in place, which will provide healthcare and also a reasonable social security for older people, we won't have a dignified old life. And the last aspect of it is what is known as the digitization and the elderly. We have a great digital divide growing amongst the elderly. There are a huge amount of technology assisted devices which are available, but many of the elderly do not know how to operate it. And can can we provide caregivers who can at least operate the technology devices? And India is, of course, we have very bright IT professionals, but at the same time, we have not been able to provide good technology facilities for the elderly. And we have also not created digital literacy for the elderly. There is no emphasis on elderly and digitization. As a result of it, even if it is involving banking, I have seen many older people do not even know how to operate their ATM cards, and they are at the mercy of people who cheat them taking their ATM cards. And we don't have any program to make them literate. As a result of it, we may claim to be in the e-technology race, but at the same time, we are ignoring the elderly. So more emphasis needs to be given by IT professionals and other people so that they can make their own grandparents IT literate and they can also join the race. So my recommendations for the future is pensions have to become universal. Every Indian should be entitled to have a pension. The healthcare has to be universal. Every district has to have a geriatric care center, and we need to have universal digital literacy for elders. And the social protection to prevent them from abuse should be there at home level, at community level, and in society. Unless we prevent our older people getting abused, we can't claim to be a great country. A great country is one which looks after its elderly and takes care of all the populations. So unless we can do this, I don't think we can claim to be a great country. So new models have to be evolved for active aging in the 21st century. And the emphasis on active aging is necessary because if you're going to live to be 90 years, you better become active and start a program which will have community exercising, which will have various societal interventions in place, which will keep them active. So we have to live to see that day when we can have this kind of active aging in our society, and maybe all live long and maybe all have a good life, and maybe also at the end of it, may all Indians have an active, dignified life. Thank you.
Yashoda? Shite?
Hello. Yes. Thank you, sir. Thank you so much for this session. We are open for the discussion. We are open for the questions. Anybody, please raise your hand or tell me or unmute yourself. Yes, Fule, sir.
Mr. Mathew Cherian. Mr.
Yes.
Cherian.
Yes.
Hello. Good afternoon. This is
Mr. Mathew.
Raina from Haridwar.
Sir, 1 minute. Rena, sir, just 1 minute. After finishing Fule, sir, we'll take your question. Yes, sir. Yes, Fule, sir.
Mr. Mathew, it's a pleasure to see you after a very, very long time. And, I have two specific, not say questions, but appeal to people like you.
that this caregiver terminology is not been so far internationalized, and in India we still don't call them, address them in a dignified manner. People like you, now I know you have become ex Helpage India, but I know you must be having clout at the Helpage India as well. And this particular aspect has to be looked into it. In Pune, we are doing the training for the caregivers, but the concept with this unorganized sector of nursing bureaus is really frustrating everybody, especially the elderly who are asking for help. Your views on that, please.
Actually, there's a lot of work going on in the field of caregiving, both by uh, SDC and by many other agencies which are doing it. And even the Tata Institute of Social Sciences also started certain modules for caregiving, etc. But this terminology of, see, sometimes we use elderly, sometimes we use senior citizens, sometimes we use older persons. There is still no kind of codification of what do we call, and even what do we call the elderly. So this is going to take time, and I think the elderly field in the next 20 years is going to explode, and we have to prepare ourselves for it. So if we don't do that, and of course each one of us in our own way, we should put in certain, of course you're training caregivers in Pune, like that there are many other people training in other parts of India, and we need to do much more because the need is going to exponentially grow, and as a result of it, unless we prepare, we won't be able to meet the need.
Thank you, Mr. Matthews. Thank you.
Yes,
I wanted to put a question. This is Mala Kapoor. Can I?
Just one
Can I?
moment. Just
Mr.
one moment,
Cherian.
ma'am. Yes. Rena
Yeah.
sir,
Mr. Cherian.
Mala,
Mr. Cherian, good afternoon. This is Raina.
Rena sir. Yes.
Yes, Cherian sir,
Yes,
it's very
Mr.
nice listening to you, and you have given a very overall picture of the aging population in the country. My submission to you is you were involved with the Supreme Court that litigation in 2016. And what did it finally really affect the aging population? Has it really affected anyway? Has the Supreme Court come out with some measures so that it affects, so that the government understands it or government starts doing anything? As far as I can see on the ground, there is absolutely no movement in states, especially in Uttarakhand. There is not even one person working for elderly on this. Not even one old age home was made. Not even one geriatric center was made. So on the ground, nothing is happening, although things were discussed even on the Supreme Court level. So the ageism is so much that something like a pension of 200 has been started some decades back, and nobody is bothered about. I don't know why. Who will take care of it? Really surprising, and what an individual, as an individual, we should be doing about it. Thank you.
Actually, after the judgment, there are few states which have changed the pension. I mentioned Andhra changed it, Telangana changed it, Tamil Nadu changed it, and these three states, and state of Delhi and state of Kerala also revised the pensions. As far as healthcare goes, there has been, as far as healthcare goes, or Orissa government has put in quite a bit of geriatric care centers, and so has Chhattisgarh state. But many states has yet to fulfill the norms, and it is still lagging behind. Some of them blame the COVID crisis for not doing it. But my viewpoint is the COVID should have made them do it faster, but they have not been doing that for older people. And I agree, there is ageism, there is a no emphasis for the elderly, and most state governments are still not. But there is money available for doing these homes. And of course, the government of India is also trying to put up one old age home in every district as per the maintenance law. But even on my last visit to the ministry, they were telling me that still there are more than 300 districts where there is no old age home. So the emphasis is not there. So that is a result of ageism probably.
So it's not happening. Implementation is not happening down. I mean, neither from center or state together or individual type. It's not happening. It's really frustrating to see what the things are going, the way it is going.
Chidambaram Rao from Hyderabad. I want to talk to.
Yeah, can I put my question now?
Yeah,
Mala, you
Chidambaram
please.
from Hyderabad.
Yeah, Yashodhara, can I put my question now? Hello?
Yes, please, ma'am. Go ahead.
Yes, ma'am.
Hello, Matthew. Good
So
to be in your forum. Yeah, I liked your talk. It was very crisp. But one thing I want to raise, and I think you didn't give much emphasis to it, but I know it is very important to you also, as it is to me, and I would like your comments more on it, is in terms of gender aspects, older women. You know, there is a lot of data we have now to show the vulnerabilities of older women, their increased life expectancy higher, but at the same time, very little is being done for them in the country. And especially, I mean, yes, we do have certain pension schemes which are specifically for widows and this, but like you said, the amount is very little. But they are left out totally or excluded totally from many programs in the country. And what are your suggestions, and what would you think should be given, prioritized in this way? I mean, pensions is one thing, digital literacy, they're out, healthcare is not reaching them, post reproductive care is quite nil in the country. You know, there are so many aspects. So, according to you, I mean, you have a vast experience. Just few points about how would you prioritize reaching out to them and making more inclusive policy and programs for them. Thank you.
Thank you, ma'am.
Dr. Mohini Giri had convened a meet for older women some time back, and I was also involved in that forum. And what was recommended was again the same issue of pension is under the National Social Assistance Program also goes to widows. But again, the widow pension is also restricted at the same level of 200 rupees. So, as you know, you work in the field of aging, women tend to live longer than men. As a result of it, the longevity is even higher for women. But there is there's no dedicated provision of greater pension for older people. And then the healthcare of older women are not given emphasis in many. And leave alone older men, even older women are completely neglected, because if you have to get to a rural hospital, somebody has to assist you to take you to the hospital. If you have no assistance at home, older women tend to get neglected at that level, and as a result of it, they do not reach even the hospital. And as this is something which needs to be done, and of course, many of us talk about the widows in Vrindavan and the widows in Varanasi, etc. But that is a deeper end of the problem, and there is still lack of emphasis for older women. And unfortunately, what has happened in the ministries also, if you're a older woman, you get looked after by the Ministry of Women and Child Development, which again neglects older women. and older men means you then land up into social justice. So there is such a unclear demarcation of duties, and as a result of it, older women are completely neglected. So no government is looking at them.
Yeah,
you, sir.
thank you.
Yes, Chidambara sir, and then Anjali Deshpande ma'am. Chidambara sir, over to you.
Mr. Cherian, very glad to see you on the screen, and I have been waiting to have a look at you. Today I could see you. Thank you for coming, and thank you for the crisp presentation you have made. Now, you have got a very vast experience in serving the rural health needs, etc., of the rural poor. Apart from the health needs, in the old age, the physical disabilities are more troublesome for the older people, especially those who are living in that empty nests. And even to apply for pension, they don't know how to do it. Somebody has to help. And even for their cooking needs, they can't cook for themselves and they can't clear. And sanitary needs, etc., to take them to hospital or to the nearest PHC, etc. Somebody should be there. Now, what I'm thinking is, the government has asked for a thought of a survey for the politico-cultural and economic factors that are impeding the that are obstructing the progress of welfare of these people. In their last this charter which they have given, they wanted to have some research on this. Do you think that something like a cultural development in each village to constitute some youngsters and some elders together to form committees and to take care of the requirements of the people there? They will know better. They will know comprehensively what are the requirements. Pension alone is not going to help. Pension may give money in their hand, but how to utilize it, they need help for that. So I'm thinking that we need to develop a system of putting up some committees in every village under the just auspices of the panchayat or even without that auspices of panchayat, self what you call self-financed committees within the village, or who can get some contributions from philanthropists, etc. I think this aspect needs to be looked into and popularized.
There are some models of this kind of work being done in Kerala under Kudumbashri. What they have is, in every village, they have something called a Community Development Societies, CDS. And they, in turn, the Kudumbashri has got elder self-help groups and women self-help groups all attached to the CDS. And they, in turn, do a lot of work for the elderly. So you will have to understand that Kerala has a huge geriatric population, and as a result of it, they have been able to harness at village panchayat level these Kudumbashri and the CDS model, and things are being delivered whatever you're requiring at the ground level. So maybe other states also have to strengthen their panchayats and delegate more freedom and responsibility towards these panchayats so that they can do it. Because just NGOs themselves cannot do it in a large scale across the country. And we have more than 5 lakh panchayats across the country, so they have to be activated. you can activate them, and then you can hope to have a better kind
What
of.
I say is that we should take up a campaign for establishment of such committees, taking the Kerala model or developing their own indigenous models in every state or every district. Some of them in many places in Andhra Pradesh and in Telangana, there are some villages, a few villages, where food supply is being looked after. Food supply for the elderly is being looked after. But other things are not being looked after. And the Helpage India or some other senior citizens organizations should take up this kind of what you call a campaigning for setting up committees. I don't think government should take active part in this because that will not come. Government contributions also should not be there because there will be a lot of other restrictions and reports, etc. that will not come. Sound, please.
Okay, sir.
Sound, please.
Anjali ma'am. Deshpande ma'am.
Yeah, thank you very much
I'm
for
not
the
able to
wonderful
hear.
presentation. I just want to know, when we were talking about women in aging, can we have some activity for them? Because in any senior citizen home or Vrindavan for that matter, you said, can we make them to not use, I would say, but to make them actively engaged into some activity where they earn for themselves? Because otherwise these facilities are going to go out of this if we just keep them for staying and eating kind of thing. So why can't we encourage them to work probably or develop some hobby? Is my question clear to you, sir?
Yeah, it's clear. There
Mhm.
are actually many homes where people are being actively engaged in doing activities either with communities or with external people coming and training them in certain skills, etc. And
Yes.
even helpage for in their homes are also doing activities. In fact, on my last visit, I saw that they were even doing an oil press, and women were also doing other activities which in their own home. Then, of course, the elder self-help groups, which HelpAge has promoted, they
Mhm.
also keep a lot of women active doing various activities at village level. So there is a need to be a thrust, because unless the management of the home is open to these ideas, it will not work, because the management also has to get involved in it. So it's our role as social workers to convince the management to start these kind of activities.
Yeah, because I feel we have been underutilizing or not utilizing them, because empty mind is devil's workshop. So even if they are into home and without work, probably they will have lot of other mental problems rather than keeping them engaged or physically fit for that matter. So which are the activities which you can recommend for homes, sir?
It depends on the local area. It has to be a certain skill which is easily trainable, because in old age all your finger movements, etc., may not be so well oiled and lubricated, etc. So you need to have certain skills which are easier to do, and some of them are also traditional. Like if you go to certain areas, you find that they are familiar with certain activities, even be it knitting, be it even embroideries, etc. So that has to be thought of according to the local context.
Okay. Thank you, sir. Thank you so much.
Cherian sir, our amendment for this Maintenance Act is pending in the Parliament for last 2 years. December 19 se hai. Sir, isn't it something that nobody is bothered? There is some conscience is not there. How to raise this conscience among the people that they should do something for the elderly whom they call they talk about the dignity of the elderly, which is not seen on the ground.
Raina Sahab, you have to ask your local MP to raise this as a question in the parliament.
Yes, yes, correct. Bilkul. We have started doing that now.
We can raise questions in parliament and we should induce our local MPs to do it.
Right. It has to be all over the country. We have to raise this voice. Then only they will be hearing it. That's correct.
Right. Okay. Thank you, Rana sir. Any other questions? Okay. Razima? Razima? Jade Gill. Okay. 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 Sir, I think yes, ma'am. Ma'am, you're not clear. This is hello. Sir, we'll just wait for 2 minutes. I think she's reconnecting to the network.
Hi, Yashodhara. Till the time Anjali reconnects, can I put a question? This is Anupama.
Yes. Sure, ma'am. Yes,
Good evening, sir. Good to see you. You always have a sobering impact on me, but somehow, after the budget that was presented in the parliament, I still have very burning question for you, which is that after the pandemic and after the impact of pandemic on the health and incomes of people generally, pushing those large numbers of people under the poverty line, you find a finance minister who freezes the budget of Ministry of Rural Development, and she says that we have done enough for health infrastructure. There's no need for additional allocation. I mean, how do in that situation? Where do you see the hope?
This, of course, budget does not give me any hope because in a crisis after the COVID, the health budget has just gone by a few 100 crores. And 100 crores for a country of this size, the increased budget is just nothing. And the rural development budget has been frozen. So many of the issues have been, many of the budgets, even the social justice ministry's budget has been frozen. So I don't think there is any hope for measures for the poor and for the vulnerable. The only thing which we can hope is if we get the panchayats to get activated into doing it, because the panchayat budget is still there because they have not tinkered with the panchayat budget, and that is where the hope lies. But unless a government has political will to tackle this, and especially the graying of India, which I constantly keep telling about, we will end up with a problem which is far, far difficult to tackle for future generations. So I think some of us were have to keep pushing the government time and again, including people like you, so that they will start doing something. If
Yeah,
we,
big responsibility.
we can't give up like that.
No, we are not giving up. Just that you feel a little more annoyed and angered. I just want to respond to Mr. Rena. He was mentioning something about the Maintenance Act. We had a recent interaction with some members of Parliament, and you'll be surprised to know, Mr. Rena, that half the people who we met did not even know that there is a legislation in this country called Maintenance and Welfare of Parents and Senior Citizens Act.
Absolutely. This
So
is
the
the
situation
problem.
is really dire. It's not that you push your MP, they don't even know.
They don't bother. We don't have in the state Uttarakhand, we don't have any department or even a peon for elderly care. They don't care, think it is important. So this is what is the
Absolutely.
indifference, insensitiveness.
Complete
This is a
complete
problem.
indifference. And
But what can we do, sir, for this? Can we do anything?
We have to get united all over the country, rural or urban. Otherwise, we have to have the voice. It must come in the Jantar Mantar. It must, people have to sacrifice. People have to cry if really we want to do something. Otherwise, every time we will hear this and leave it from one ear to the other.
Exactly. We must be
Is
united.
there any integrated views we should adopt for taking elder cares? Like there are so many socially excluded classes we came across. The socially excluded classes like differently abled, then even widows. Can we have a such integrated model, or is there any such model working?
For elderly, no model working.
There are networks of disabled people who are now talking to elderly also. So I think it's work in process. At least a few NGOs in the field are talking to each other. So I think we need to get more people talking to each other. Once we have this, then we can create a forum which can argue the thing. Otherwise,
And,
we all work in silos, each one to themselves. So as a result of it, there's no coordination between the various groups.
Do we just expect government to do legal
No.
reforms,
Government won't do.
legal awareness?
It's up to civil society to join up together and network.
Exactly. If they see there's a size of nation and the budget and the utilization of size, every marginalized community, whether it is elders or differently abled persons, will not be justified. As we see that health budget is just 100 crores up with respect to last year. If that is the scenario, then it will be very difficult for years for politicians and executives to look into such issues. So there should be, apart from government, there should be CSR, individual crowdfunding, some integrated kind of sandwich kind of approaches which may cool down the burden of socially excluded classes. And that I feel, given the circumstances right now we are traveling through, youths are going to cut down their job, underemployment, half employment will rise. Same is the case of older aged persons. So in that case, we have to give a different thought rather than just coming at. We should come to Jantar Mantar. We should continue to force our voices in the ears of government, but there should be some other models also parallelly working for this.
But we have to join forces. If we don't join forces, we won't be able to do anything.
And I think for that we should always we must be open. We will be we might be open. I don't know really. We should call upon disabled and NGOs working on migrant workers to have some different kind of thought to solve their issues with government, without government, or PPP model or with CSR model. ultimately, end of the day, we need to find what solution on ground we are delivering. Only agitation or some sort of relief. That thing will sound a lot. So we have to make a next session where we have some socially excluded NGOs voices also with us, and we are discussing with some sort of
Digitization of youth in school and colleges is also required regarding the aging population. And the society
Yes.
has also to grow and talk. We talk about corporate social responsibility. There were about 25,000 crores raised in 1 year, out of which hardly any crore has gone to senior care, although it was there within that annexure, elder care. But people have a society has also its own ageism. That's the problem.
Yes. 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 Okay. Thank you, Rana sir. Thank you, Rao sir, for joining. And as you mentioned, Rana sir, we have to be united and keep working. I want to request Anjali ma'am to conclude the session. Thank you so much for joining us today. Anjali ma'am, Raza ma'am.
Yeah. Matthew, sir, you have spoken so eloquently on this issue of the graying of India, where today we might have a population, the youthful young population in large numbers, but 30 and 40 years hence, where they are going to be in larger numbers as elderly and going to live for 30 years more post-retirement. Are we as a country well equipped to deal with the issues and aspects of, qualitative healthcare, addressing their social and economic needs? I think you've brought out this point very validly. And also the issue of the rise in the empty nesters that you spoke about, which would necessitate restructuring of the family system. It would also require new models of senior caregiving or senior care, where older persons, as you said, are more demanding today, wanting better and qualitative healthcare. We are not really very well equipped right now to deal with these aspects or these needs of the elderly now, and are we really well equipped to even deal with, would we really be well equipped to deal with them, say 30 years hence, if we don't start planning and working and implementing them today itself? The paltry pension that you so rightly pointed out, that is being given to elderly, really it's an affront on their dignity as a human being. We have been raising, as you have been doing a lot in this field, of pensions and wanting better human rights for the elderly in various aspects, but not much is being done, and we agree that not much is being done. But how do we go about getting this done has been, I think, the most important point of our discussion right now. um, Frailty, which you touched upon, is again another issue that requires frailty, especially after 80, the age of 80, is an issue that requires its urgent addressing from all, the healthcare angle, the economic angle. And one other recommendation amongst the various recommendations that you spoke about, the technological facilities and the digital literacy required for elderly, which is lacking, as you said, rightly so. I think ILCI, in its own very small way, is doing its bit by having started the mobile literacy training program for senior citizens in 2016, where we are looking at making the elders get rid of the fear of the electronic gadgets, especially the mobile, which can be their bank or their friend, as our president, Dr. Mashirkar, and Mr. Umbranikar have always been referring to. We are doing our bit, and hopefully we've got many other organizations also trying to get this elderly population more digital savvy. I think, sir, to sum up, listening to you has always added to one's knowledge, and I think you've done it again today. Thank you so much for being here, and we really are very grateful to you. Thank you.
Can
Yes,
we
sir.
have YouTube video, please, madam?
Yes, sir. Yes, sir.
Recording,
It's there.
if
Yes,
you could.
recording is live. So I can share the link with you, and it is available on our YouTube channel, sir. You can just
YouTube
type
channel.
YouTube International Longevity Center. Yes, yes, sir.
because we
Okay.
need to study so many things come up.